Why are infection control and OSHA training important? Well, infection control is in our hands. Our patients expect us to care for them and to make sure that they're safe when they're in our offices. Have you got infection control? Think you do? You can think you have infection control, or you can know it. How do you know it? Well, is there an OSHA or infection control coordinator in your office that oversees the equipment that's used, the products that are purchased, the personal protective attire that's available? What kind of training is offered? See, these things can all tie into an infection control program that can help you know that your patients are safe. You see, patients have to trust us. They can't otherwise feel safe in our practices unless they know that when they come into our chair, they're not going to get a bacterial infection from the last person that sat in the chair. How do they know? Well, they ask the assistant, can I get a staph infection or MRSA from sitting in your dental chair? And the assistant would say, no, you really can't, because we disinfect our dental chair after every patient. We use the right products for the right amount of time, and we use the products correctly. Well, is there any chance that I could get an infection from the instruments that you use in my mouth? We make sure that every instrument is cleaned properly after each patient. Not only is it cleaned thoroughly, but we check to make sure that there's no debris left on the instruments. And then we carefully wrap those instruments and place them in our sterilizer. We use the sterilizer according to the manufacturer's directions for the correct amount of time, and we make sure that the instruments achieve sterilization by spore testing once a week. Now, of course, our patients don't know what spore testing is. In fact, they may not understand the difference between disinfection and sterilization, but they trust us because we sound knowledgeable about infection control. And when we sound knowledgeable about infection control, patients will feel safe in our care. OSHA compliance training is important because not only is it required by federal and state governments, but it also helps you to create a culture of safety in your office. We know that an office that is in compliance with OSHA has safety plans. Does your office have safety plans? Do you know exactly what to do, step by step, in the event of an exposure incident? You get stuck with a contaminated instrument. Do you know immediately to provide first aid? Do you know what questions to ask the patient? Does the employer have medical care available for you to access promptly? If these conditions are not in place, not only is it an OSHA violation, but it's also a great jeopardy to you as an employee because you might contract an infectious disease from the patient where it could have easily been prevented. So OSHA and infection control knowledge is our best weapon against infectious disease transmission.